A total hip replacement with a posterior approach is a joint procedure that begins with a curved hip incision at the back of the hip close to the buttocks region, behind that greater trochanter of the femur and at the tensor fascia lata. The gluteus maximus fibers are then split in order to detach the short external rotators and the tendons in order to gain access to that hip joint. Then the artificial components are fixed in place after dislocating that joint, and then the surgeon should repair the external rotators and that posterior capsule in order to reduce the risk of dislocation post-op. In postoperative clinical findings, there is a higher risk for hip dislocation in a total hip replacement with a posterior approach compared to an anterior approach in post-op. So hip precautions are put in place that may interfere with normal hip functions, as well as some weight-bearing restrictions. Some of these precautions may include no bending or flexing at the hip past 90 degrees, no adduction past neutral or crossing the knee over your midline or crossing your legs in general, and no internal rotation past neutral, so no pigeon toes, as well as no picking up or bending past a 90-degree angle. One example of a functional activity that can be done under normal circumstances or under normal hip function is sitting in a chair cross-legged. However, this task can violate many of the post-operative restrictions that are placed after a total hip replacement with a posterior approach. First off, sitting in this low chair, you can tell that my legs are flexed past a 90 degrees angle, therefore my hip is flexed past a 90-degree angle. And an easy way to be able to tell this is that my knees are at a higher level than my hip. Now, at that degree of flexion, while crossing your legs, you are adducting the hip and you are bringing that knee over the midline. Both of these actions combined produce a great risk for hip dislocation in post-operative situations after a total hip replacement with a posterior approach. An alternative way to complete this task that will accommodate for these post-operative restrictions would include choosing a chair that is sturdy to the floor with armrests to bear your weight and is at an appropriate height. One way to be able to tell that the chair is at an appropriate height is to use the back of your leg in measurement with the bottom of the chair. For example, if the bottom of the chair is adjacent to the upper posterior half of your leg, it is okay to sit in that chair. If the bottom of the chair is adjacent to the back of the knee, you should take some precautions when sitting in that chair. However, if the bottom of the chair is below the posterior knee and at the distal posterior half of the leg, you should not be sitting in that chair, or you should place a cushion on top of that chair in order to raise its height so you can sit an appropriate level. So, for example, this chair is adjacent to the back of my knee. Therefore, I need to take precautions when sitting in this chair with my injured hip. When sitting in this chair, I will make sure that it is sturdy to the ground and has armrests first. Now that I see that it has armrests, I will use those armrests to bear some of my weight while I place myself on the chair. First, I will begin to extend the injured hip leg while I place my weight on the arms of the chair and slowly lower myself in the chair. And while I'm sitting in the chair, I will try to keep this leg extended in order to prevent hip dislocation following post-operative restrictions.